Hello.
Hey, hello.
My name is Katya. I'm going to be a nurse today. We are going to do the overall assessment of the body. Would you please tell me your name
Julie.
and the last name
Scotty.
and the date of birth?
June 1st, 85.
Okay, great. Do you know where are you now?
At your home.
Okay, and do you know why?
Because you live here.
Okay, and what is the year
2021.
and date?
17 April.
Okay, in time, do you know, like
Yes.
approximately?
9.5.
Okay, great. So the patient is oriented. I will say that he is 15, score 15, the Glasgow coma. He's conscious and oriented. Now, what I'm going to do, I will check for the pain. Would you please close your eyes and tell if it's dull or
For sure.
or sharp?
Sharp. Sharp. Dull. Dull.
Okay, so the patient has a sensation in both hands and both legs, which is normal. He doesn't, which is normal. Okay, now I will check for the skin. Would you please take off your shirt, please?
Yes. With
Okay.
pleasure.
Okay, I will check for the skin. The skin is smooth and the turgor of the skin is good. It's not dehydrated. The hair is growth evenly. I don't see any cyanosis or pallor, cyanosis or inflammation, redness, which is good. Now I will check for the pupil constriction. Would you please look on me? Okay. Okay, the pupil constrict evenly, round and evenly. It contracts to the light. Now we'll check for the mucus. Would you please open your mouth? The mucus is normal. There is no lesion and it's not dehydrated. The color of the mucus is pink, which is normal. No redness or anything abnormal that I saw. Now I will check for the carotid artery. Would you please? Are you comfortable now?
Yes.
Okay, I will check for the carotid artery. You can lay down. Okay. Okay. I didn't hear any bruits, which is good. Now I will assess for the breathing. The patient. Do you have any problem with the breathe?
No.
No. Do you have any cough?
No.
No. Okay. So when I check for the patient breathes without any difficulty. The accessory muscle is not he doesn't use his accessory muscles. The shoulder is not elevated, the clavicles, and he breathes from his nose. Пожалуйста, я буду переписывать. Okay. Now I will auscultate further for the lungs. Would you please breathe with an open mouth? Can you just sit down, okay, and do like this, okay? And can you please open your mouth and breathe with an open mouth? If you need break, just let me know, okay? Не быстро.
Scotty, no!
Открой. Нормально дыши. Okay. I didn't hear any abnormal sounds. I didn't hear any crackles or stutter, which is normal. Now I will check for the heart. Do you have any pain with your heart, any
No.
palpitation, heart
No.
rate,
No.
fast heart rate? No.
No.
Okay. Now what I would like to do, I will auscultate for the heart sounds. First I will auscultate with the diaphragm. Okay. Aortic. Pulmonic. Tricuspid.
Don't worry.
Mitral. With the bell. Tricuspid. And mitral. The heart sound was sound was normal. It wasn't irregular. It was I didn't hear any murmurs, which is normal. Now I will check. I will auscultate for the apical pulse.
Так и будто.
Okay, the apical pulse was normal, it wasn't irregular, it was straight enough, it wasn't full bounding, it was +2, I would say. The S1, the sound S1 was louder in the mitral valve, and the S2 was louder in the apical valve. Okay, now what I am going to do, I will check for the bowel movement. Do you remember when was your last bowel movement?
Today.
Do you remember what the consistency and the color?
No.
No. Do you have any diarrhea or constipation, pain?
No.
No. Okay, great. So may I check? Would you please lie down, and I will auscultate for their bowel. Okay. I heard the bowel movement. It wasn't overreactive, and it is normal. Now I will check for the tenderness or pain. If the patient has, please let me know. I will go into palpate it lightly. Let me know if you have any pain.
No.
Что
No.
так сделал?
No.
Почему так сделал?
No. Холодно.
Do you have any?
No.
So that my hands are cold.
Yes.
Okay, I'm sorry.
No.
Okay.
No. 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 No.
Okay, you don't have any pain or tenderness here.
No.
Okay, great. I will check further bilateral, no, I will check for the radial pulse. It also normal +2 in the two hand, the same. I will check for the capillary fill. It's also good. It less than 2 seconds, which is normal. The circulation is good. Now I will go ahead and check for the pedis pedal pulses. I will check for their dorsalis pedis and for the posterior pedis. The pulse and the pedal pulse is normal as well. It's not too hard, it's regular, not superficial, which is good. Now I'll check for the capillary fill in the toes. The capillary fill also normal, less than 2 seconds, which is good. Now would you please pull your legs? No, pull. Pull. Okay, can you push? Okay, good. The patient has strength in both of his legs. Would you please lift your legs for a couple of seconds? Okay, it's good, it's good enough. Okay, the patient doesn't have any drift, which is good. Would you please sit down? Okay, I will check for their bilateral strength in their patient hands. Would you please squeeze my hands? Okay, he does has strength in both of his hands. Okay, I will aspirate for your lungs in the posterior chest. Would you please turn around for me like this and sit straight and open and breathe with your open mouth. Okay. Нормально дыши. Okay. Also in the posterior chest, I didn't hear any abnormal sounds. I didn't hear any crackles, any stritters, or wheezing, which is normal. Now I will check for the pressure damage. I will that if patient has any pressure ulcers, I will check it in the back, in the shoulders, in the coccyx, in the elbows, in the second elbow, and in the heel. Can you just show me your heel? Okay, good. Do you have any question for me?
No.
Are you okay? Do you have anything?
Perfect.
No.
Nothing. Everything
Nothing.
amazing.
Okay, so we done with the whole assessment of the body. Thank you so much. I will sanitize my hand. I will document everything what I found, any abnormalities, but I don't have any abnormalities. So I'm done. Thank you.